Spring sports season is ramping up for kids, and with the fun and competition can also come injuries. Joining us now is Dr. Eric Small, a pediatric sports medicine specialist with the Mount Sinai Health System, with some tips on keeping your kids safe. Good to see you this morning.
Yes, good morning. Great to be here. Finally, spring is here, so we can get outside, start doing our spring sports and activities.
Yes, so you have baseball, you have softball, tennis. They all involve throwing. What are some ways to prevent shoulder and elbow injuries? That's a big problem.
Yes, well, I look at that and tell parents and coaches all the time in the office and on the field is threefold: that starting now, your child should be having a catch or doing a throwing program 3 times per week at successive progressive distances, 45 feet, 60 feet, 90 feet, doing 10 or 15 throws at each distance and progressing per day and per week. So that's number one. Number two is to strengthen those upper back muscles and strengthen the core muscles, because the stronger the shoulders and upper back and base are, will prevent injuries in the shoulder and elbow. And thirdly, from a biomechanical point of view, we should look at the throwing motion or the tennis serving motion. We should have a video from your phone, have a coach, physical therapist, or a sports medicine physician look at the biomechanics of the throwing mechanics.
And there's been a spike in teenage girls with ACL injuries. Why is that happening?
Okay, well, for several reasons, their ACL injuries have reached epidemic proportions in female adolescents. Number one, there's a lot of sports specialization, especially in the past 5 years. So whereas 5, 10, 15 years ago, athletes would play per season, different sports in the fall, different in the winter, different in the spring. So they're not working on their what we call jumping mechanics or their running mechanics. So when they run or jump, they land with their knees hyperextended, and there are certain drills that one can do to prevent that. So the number one thing is that they're landing and running with poor biomechanics.
And I wanted to ask you, what are some signs an injury is more severe and that the child needs to see a doctor?
Yes, so I get asked that all the time. When should I see Dr. Small? When should I go to urgent care? When should I go to the emergency department? If there's a limp or a change in the running mechanics, the child should seek medical advice. If there's persistent pain for more than several weeks, if there is decreased performance, or something just doesn't look right in the throwing mechanics or the kicking mechanics, or if you're just concerned that something does not look right, if there's persistent swelling. These are the numerous things that one should be concerned about and investigate.
Dr. Eric Small from Mount Sinai Health System, thanks so much for taking some time to talk to us this morning.
It's great being here. Thanks. Have a great weekend.
Yeah, enjoy the first weekend of spring. Yes.